Hi there, this is Connie Welch with LifeBeyondHepC.com. Well, it's been a while since I've given a report about my post-treatment recovery from Hep C, and wanted just to share with you today. I'm celebrating a very special mile marker this year in that I've been 3 years of post-treatment for Hep C, and it's very exciting. I continue to be cured of Hep C, and my doctor has told me my new diagnosis is Hep C resolved. My doctor continues to want to follow me out until I get to a 5-year mark. And with that, I'm doing once a year, yearly sonograms on my liver, full liver panel and blood work, and also physical exams. So I'm doing very well, and this was a long 20-year journey to finally get to this place of being Hep C free. And you know, the Hep C giant is dead, so yay. And you know, I can really say that I'm no longer looking over my shoulder and wondering every time that I do blood work, is it really gone? Is Hep C coming back? You know, those doubts, those little twinge of fear and concern that we all face when we go through testing, you know. But after a while, and you get a long stretch out from treatment, and I'd say it probably took me a good over the year to getting close to 2 years before I actually was able to kind of not go through some of those thoughts anymore when I approached a test. But you know, now being able to go through and get the testing done, I just know this is routine, it's very proactive, and it's a good thing to do. Now, most doctors don't follow out that long, and I understand that, and don't panic if your doctor doesn't do that. My doctor and I have a long 20-year history, and you know, he has assured me, as well as studies that I have also researched and read, that once you achieve an SVR 12 and an SVR 24, which SVR stands for Sustained Virological Response, and once you have reached 12 weeks from post-treatment and 24 weeks post-treatment, which there's very little difference in the two, but with testing, once you have achieved that and continue to be non-detected for the virus, you have a less than 1% chance of the virus returning. Now, to fully understand this, the Hep C virus mutates and changes in the body and replicates every 6 to 7 hours in the body. So that from that length of time, 24 to 24 weeks, if you continue to be non-detected for the virus, your chances are very, very good that you are going to remain free of Hep C and totally cured. So don't panic. You know, if your doctor wants to continue out a little bit longer for you in your post-treatment recovery, again, just see this as very proactive and you know, very good for, you know, your medical exams and things like that to stay up with your blood work. So, but I'm doing very well. From treatment, it took a while for all my side effects to go away. In my treatment that I did in 2012, I did a combination treatment that had Incivec and peg interferon and ribavirin. Now, for me personally, and for most Hep C patients, recovery is somewhat different for every single patient. But for me, it took about, you know, 6 months to really a full year to where I fully felt recovered, where I felt like my energy and my stamina and my strength had returned back to normal, and my hair grew back. I lost about 40% with hair thinning from that treatment, but that grew back. The blurred vision that I had experienced during recovery and a little bit afterwards, all that cleared up. My liver enzymes, all that went back into normal limits. The the loss of appetite and insomnia and intestinal issues that I had experienced, all that resolved and went away. So, it took a while from recovery. Once I went through treatment, which for me, my treatment was 24 weeks, because at the time, with that particular treatment, that was the standard. Actually, that was considered short, because a lot of patients at that time were having to do treatment for 48 weeks. I went non-detected for the virus the first 4 weeks of my treatment and continued all throughout. But some patients, it's not like that. Sometimes you don't achieve non-detected till a little bit later on, which is okay, But the new treatments that are out now, the gold standard now is generally 12 weeks for treatment. There's less side effects to deal with than before. Treatment is done in that shorter length of time, like I had mentioned. And there's an extremely high cure rate now, for over 90% for all the treatments out. And there are a lot more treatment options out now for a broad range of genotypes compared to what it was even 3 years ago. So we've made tremendous progress in the medical community to be able to eliminate Hep C. But I've done very well, and I wanted to let you know that I can say now that I'm no longer, looking over my shoulder. I feel very good. My energy, my stamina, my strength is returning. I just feel really well, and it's amazing to be able to feel like you can go on now with life and not have to be thinking about Hep C and dealing with those issues all the time. So you will get there. I just wanted to encourage you. There's 3 phases of Hep C. There's the diagnosis and preparing for treatment and finding out all there is to know about Hep C. That's phase 1. Phase 2 is treatment itself. Phase 3 is recovery. And recovery does take a while. So don't get discouraged if you've gone through treatment and you don't instantly feel better. It just takes a while, and have patience with the process. And we're celebrating this 3 years of being free from Hep C. And we have the website, lifebeyondhepc.com, where we offer a wide variety of resources to help the patients and their families. And I hope you will come and join us for all the information that we have to offer and help. And I just want to encourage you today that if you're just being diagnosed, or if you're in treatment or in recovery, that there is hope. You will get beyond Hep C. You will get through this, and we're here to help you. And I just wanted to thank everyone who has been so supportive and being here for me, and all your prayers, all your just a friendship connection, being there on the website to be able to interact with each other. It's just been phenomenal. And I just can't tell you how much I appreciate each and every one of you. So I hope you will join me soon as we continue to talk about Hep C and all the different phases and the resources that we have to offer, and what we can do to help you to be able to achieve that goal of being free from Hep C. So talk to you very soon, and God bless. Bye-bye.